Okay, all right. Well, let's go ahead and get started. Thanks everyone for joining us today. I'm Danielle Varda. I am the CEO and founder at Visible Network Labs. I'm also a professor at the University of Colorado, Denver in the School of Public Affairs. And just really glad to have you here today. This is our monthly webinar in our series on strengthening social connectedness. We have some pretty amazing speakers today that you're going to hear from. Dr. Kathy James is an associate professor at the Center for Health, Work, and Environment at the Colorado School of Public Health. John Kennedy, a senior project manager for the Rural Connectivity Lead at the Colorado Office of eHealth Innovation. And Miko Pickett, the executive director, PIC 42 Foundation. And I think what you're going to see is that these folks have a number of different roles and titles in the things that they do. So we'll be able to learn more about them in just a few minutes. I'm going to spend a couple minutes here just talking a little bit about why we put on this webinar. So at Visible Network Labs, we are an organization that has a purpose to make invisible networks visible. We know that people are all embedded in some kind of social support networks, social networks, but they're pretty invisible to not only ourselves, but the people who are trying to help us. And our mission is to make those visible to the people who are trying to help us in ways that we can leverage connections, build strong connections, and also sometimes reduce redundancy. So for lots of different reasons, folks are interested in this. Our team is a pretty awesome group, and I always want to acknowledge them. We're a social enterprise, and our mission is dedicated to strengthening social connectedness, and we envision a world where everyone has the social support that they need. So we do that through trainings and workshops and webinars, but our primary product are technology-based data and mapping tools. And just a quick look, we like to always show our people who are behind all of this as a network map, but we have our in-house engineers and data science team. If you want to know more about us, please look into it. We're a pretty fun team who get to geek out on network science all day long. When I said that we do build technology, our two primary ways of doing that is through the partner platform, which is a tool that communities use to map their network connections and try to understand the value of those connections and the quality and quantity of them as it relates to outcomes, either big systems outcomes and systems change, or also things like efficiency and effectiveness. We also have created and manage a tool called Partner Me, which is a tool that allows people to understand the social support networks of individuals. And this is primarily used by what we call the helping professionals. So it might be a provider, a counselor, a teacher, anyone who's kind of really trying to help people navigate resources. And it allows people to kind of draw and visualize these social connections so we can identify people who have gaps in their social support, and also to identify where people have strengths in their social support systems, and then how we can use that information to help them really get the care that they need. Our purpose, our goals of these webinars are pretty simple. One, we are on a mission to strengthen social connectedness. So our team has been working on this as a mission for years and years. And we know there's lots of people out in the world doing the same thing. So we just decided it would be really fun to have a time to bring people together, identify people in different topic areas, to come and help us think through this kind of complex topic in ways through examples. And secondly, we're working on building a learning and innovation community around this topic. So that's you, the people who are here attending today. You are that community, and we encourage you to put your information in the chat, say who you are, why you're here. If there's someone who looks interesting to you, please connect with them. We have lots of people follow up and ask us to present or about certain topics, and we love that. We welcome that. So that's a big goal for us. We just had some questions about our webinars. So this is our schedule. You'll see it goes back to January where we started. And you'll see we're here at July. We have some stuff going forward. So next month, we're actually featuring our partner CPRM, which stands for Community Partner Relationship Management Tool. We're releasing a new version of it, so we're just taking this time next. I get to present it next month. But you'll see in the future months, we're going to focus on social connectedness and public policy solutions, tech solutions, and then we'll also focus on Partner Me, the other tool that I mentioned earlier. So this is our announcement for the webinar coming up in August, on the 31st of August. If you're interested in that tool and how to use it and how it can help your community build capacity. And then on September 28th is when we'll be doing our webinar on strengthening social connectedness through public policy. And we're focusing from UK over here to look at how government and public policy has been implemented over the last few years to really strengthen social connectedness. All right, so we're going to jump right into this. And the first thing that we like to do is something we call Visible Us. So unlike a normal webinar, when you come in and people just start presenting slides, we think in the spirit of creating community, we really want to know who's here. So we like to do a little Mentimeter to highlight the community of attendees. So take a minute and either snap the QR code or put the Menti, oops, I think that should say menti.com. Let me see. Oh, it does. Sorry, I had something there. And put this code in so that, and Alex will put the code right there in the chat so you can catch it once I move. We're going to have two questions on the Mentimeter. The first one is, we just want to know who's here today. And we are hoping you'll put in 3 words that describe you, and not necessarily your title, but a little bit more about who you are. Like, what's your job? What's your family like? Do you have an adjective, a hobby? Like you might say, I'm a teacher, an uncle, I'm carefree, I'm a painter. We like to do this because it gives us a better sense of the kinds of people that come and care about social connectedness and puts a little more of a human lens on this work. The second question will be, what words or phrases do you think of when we talk about rural social connectedness? So I'm going to stop sharing for a second so that I can open those up and get started on it. I think I need to, is it working? Can someone give me a indicator that it is?
I need the code again.
Okay. Yeah, it should be in the chat. Let's see. Alex, have you put in the chat?
Thanks.
Yep. Yeah, the chat should be in the code.
Okay. And I think this is us. Hopefully I've gotten the right one up. Okay. Okay, yes, it's moving. So this is always a little nerve-wracking. I never quite know if I'm going to get all the movement right, but this is really fun for us because we go to so many webinars and we just really don't know, who's there and what people love and what they're doing. But we think social connectedness is all about this part of what we do. So I never present this really well. We always share it after, and we almost use this like a data collection to try to understand who shows up. So lots of activity. Thank you all so much. We have a couple moms, creative learners, advocates, dog lovers. These are all showing up, yogis. But we also have, let's see, accepting, resident service coordinator, international, compassionate, goofy. Wonderful. I already know it would probably be fun for all of us to be in person and have a little lunch together after this. Awesome. Okay, well, you can keep going with this one. If you've gone to the next slide, here we go. So what words or phrases do you think of when we talk about social connectedness? So again, we've done this work on these webinars on different topics, and we're really struck by the words that come up when we think about social connectedness for different populations. So you should be able to just go to the next one and start putting in some words or phrases. So we did this for older adults, for veterans, for youth, and there is a lot of similarities, but also some pretty significant differences that help us set the context for what we're all here to discuss. And in this case, social connectedness in our rural communities. So awesome. You all are really active today. Thank you so much. Right. And something I expected was this blend of the positive and almost the challenge, in rural communities. So let's see, we have transportation, word of mouth, resilience, community, internet, disconnected were the first two that I saw. Challenging, belonging, resources, no activities, loneliness, tight knit, family focused. God, it's going fast. Wonderful. Yeah, look at this. Word of mouth, community, and neighbors are our top three here, but also challenges, resources, resiliency, lonely. So this really does set the stage for us in terms of a little bit of how things get done in rural communities. We can see some of that here. Some cultural and it looks like kind of historical nature of rural communities. And then also quite a few challenges. So what I think you're going to really love today is that our three speakers are, I think, going to cover all of these things. So let's go ahead and move into that. Thank you all so much. We'll capture these, and when we put the slides back out, we send them back out to you. We include these so you can see it as well. Great. Well, thank you all. This helps us connect with you a little bit, kind of get to know you, and we just really appreciate that. All right, so I'm going to go back to our slides, and we're going to finish out our Visible Us with one more thing before we get started. Again, we don't like to just jump right into presentations because I am always curious in a webinar, like, who are the people behind these projects and why are they doing this work? So we don't really get that a lot in our presentation. So our style here is connection and just to be a little bit informal in this way. So I'm going to pause for a minute and ask our three speakers a kind of broad question. I'm going to ask each of you to take just a minute or two to tell a little bit about your story. How did you end up working in rural communities? What got you to focus on this topic, and how does it relate to you personally? So let me go ahead and maybe I can start with John. Sorry, I'm having trouble finding.
Everybody can hear me, correct?
There you are. Yep, we're good.
All right, good, perfect. Yes, I started with Medicaid, kind of led me to this. I have a mother who's disabled and uses Medicare and Medicaid services, and so it's near and dear to my heart.
Hey, John, you know what? We just lost a little bit of your audio. You just faded out. Yep.
No worries. How about that? Better?
Perfect. Yes, perfect.
No worries. So yeah, trying to see if it's something I got up. Nope. Okay. Thank you for your patience. So yeah, just I have working in Medicaid and working with that, and working with HICPUF, for those that are familiar, that's the state's Medicaid agency. And then seeing some opportunity for improvement and how I can better get to more Coloradans and better help those that in need, and how I could do that. It's something that I like.
Excellent. John, are you from Colorado?
I am not. I am originally from Florida.
Mm-hmm. Nice. And where were you before you were working at Ojai?
I was with HICPUF, the Colorado Medicaid agency, the state agency.
Excellent. Okay, thanks so much, John. It's always nice just to have a minute. How about if we go over to Miko now? Maybe you could tell us a little bit about how you ended up working in a rural community.
Sure. My path here is untraditional. So I'm a Jersey girl, and there's almost no part of Jersey that's rural. But I married a man from South Carolina, and we spent right near Myrtle Beach. And for all of our marriage, we would come to Myrtle Beach and we would visit this small town to pick up his mother or spend time here. But it wasn't until 2016 when Hurricane Matthew hit this community. And by that point, my mother-in-law had passed away, and we had remodeled the family home. And Hurricane Matthew is really what exposed us to what rural communities are like. The fact that they are more connected than any place else I've ever lived. The fact that how they embraced us, especially in the time where everybody was suffering. Almost my whole community was touched by this hurricane. And so through that, we decided that we were going to move here full time. And the rest is history that I'll tell you guys about later.
Wonderful. Thank you so much. I'm impressed with how brief you all are because your stories are pretty rich. And I know that we'll get to hear more about that, each of you in a moment. All right, so Dr. James, let's spotlight you and maybe you could tell us a little bit how you ended up here.
Sure. So I am a researcher at the University of Colorado School of Public Health, and I have a background in water engineering and epidemiology. And so my research passion is in conservation of water resources, especially as a result of climate stressing and drought. So most of my research focuses on rural communities that access aquifer systems, especially farmers. And I have a strong passion for farmers. My family is from an extensive farming background. They're dairy farmers. Most of the farmers I work with are potato and cattle farmers, but the community is so connected. I think Miko said it best. They're very connected, and they're also probably support a lot of the work that we do because they have probably the most extensive grassroots, boots on the ground efforts for supporting their communities. So, and thank you for inviting me, and it's nice to meet the other panelists also.
Yeah, well, great. Thank you so much. We're going to hear a lot more from each of you. We're going to jump right into it now. I'm going to share our slides. So let me try to do this. Whoops, one sec. Thank you all for being here today and being willing to share your stories and your work. We're going to go ahead and get started with Miko. This is Miko is the executive director of the PIC 42 Foundation. If it's okay, Miko, I'm going to read your bio for a quick minute to introduce each of you. We didn't quite do that. So Miko Pickett is the executive director of PIC 42 Foundation, where she works to meet the needs of community members dealing with food insecurity, overlooked farmers of color, assisting with disaster recovery, and other community-focused programs. In 2019, Miko retired from a successful 30-year career in corporate America to fully embrace her work in the community. She currently serves as a vice chair on the South Carolina Food Policy Council Board of Directors. Miko loves her family and has been married to her husband, Dominic Pickett, senior for 34 years. They have 4 children, 2 daughter-in-laws, and 3 grandchildren. She and her husband also run a few small businesses. She enjoys Southern living, traveling, line dancing, and music. I'm going to let Miko do her own little intro here, but I just have to say I admire anyone with this kind of signature line. Doing this many things in a community all at one time, playing so many good leadership roles. So Miko, thank you so much. I'm gonna leave your slides for you, so just let me know when to go next, but I'm gonna let you get started here.
Let's go. Great.
Sure, awesome. I say, hey, look, enough about me. I thank you all again for the opportunity to be here and to present the work that we're doing in PIC 42 Foundation. I love the questions in terms of how we got started, but one thing I did notice is that there's another dancer in the room. So to that dancer, I want to say, hey, I love line dancing. And and you're right, Danielle, a lot of us, especially women, we wear a lot of hats. But the one thing that I believe wholeheartedly in is work hard and play hard. So you go to the next slide.
Oops, sorry. There we go.
So I'm going to talk to you today about Marion County, South Carolina. That's the community that I serve and the community that I live in, right? And I'm a Jersey girl born and raised, and I'm down here by transplant, and I love it. It's actually South Carolina is the 4th state that I've lived in, and it is the state that is, the people are the most resilient, the most awesome people, the hardest working people, and I think that's why our nonprofit, why we work so hard, because it's not just us. The tagline of our organization is neighbors helping neighbors, and that's really what it's about. So earlier today, when Danielle asked me, what brought you here? And I mean, honestly, it was the storm. So what you're looking at is a picture of our community. So on the South Carolina, you can see that little red in there. That's 489 square miles where only 31,000 people live. So, I kind of conversed that. I looked that up from where I grew up. I grew up in a town that was 3.4 square miles and 17,000 people live there. You know, so, you know, and this is our whole county, right? So it's very broad, it's very beautiful. Our whole state is an agricultural state, although there's some interesting facts about the fact that we're an agricultural state, but we import most of our food. Figure that one out. So our community itself is made up of about 56% African Americans, 39% white, and a little bit over 1% other. So it's a majority minority community. And the poverty rate in our community is 24%. So if you think about not just Hurricane Matthew that hit our community in 2016, Hurricane Florence hit our community in 2018, and then COVID in 2020. So my husband and I had started Pick 42 Foundation when we lived in Charlotte. We were in Charlotte for 15 years. And the hurricanes, you know, moving us down here really truly started our activism, you know. So throughout these next slides, you may hear me say some things about Marion County that may come off as negative, but please know we are resilient. You know, Marion County is resilient. Her people are resilient. We struggle. Some people struggle with poverty and some people don't, right? But the bottom line is, what I love about where I live is that what happens to one happens to all. So you see this fireman rescuing 2 little children, you know, people ended up taking in neighbors, taking in friends. And here we are in 2022, and people are still displaced from the storm. Next slide. So I'm gonna take you through some of the programs that Pick 42 Foundation, Neighbor Helping Neighbors, what we do. And when I say we, it's more than just the board of directors and the staff and employees of Pick 42. It really is community, right? And so we live and die by donations, right? Donations come into us, be it food donations or monetary donations, and that's how we survive, and we're able to provide services to the community. However, I'm gonna tell you guys, what means the most to us is when a neighbor comes and knocks on my front door and they have a $1 bill, a $2 bill, $2 or $5, and they say they want to make a donation to Pick 42 Foundation. That money drives us more than any large donation. We appreciate the large donations, don't get me wrong, but it really is about community. So this slide kind of depicts for you some of our programs around food insecurity, fighting food insecurity. We have a mobile food pantry in which we work with our local food bank, Harvest Hope, and every week we pick up a box truck full of groceries, and we deliver it to up to 9 different partner churches and nonprofits, and then they deliver the food to people in their communities, right? So it's not like Pick 42 Foundation, we couldn't hit all the county alone, but through our partners through the churches and through the different nonprofit organizations, they know where people are that need food. And so you can see our little box trucks there and one of our volunteers. We also started the Marion County Food Policy Council. And the Food Policy Council is where we gather like-minded folks so that we can get together and talk about food issues as it relates to our county. So restaurateurs, farmers, interested community members, people in nonprofits, and we're looking to set policy for food in our county, and also to feed that policy up to the South Carolina Food Policy Council, on which I sit as vice chair on the board of directors. So some programs that came out of our Food Policy Council is our Reimagined Gardens program. We have started our first community garden. So excited about that. And you can see that young man up in one of the pictures planting a tomato there. You know, we involve the youth. We work in partnerships with the school, Clemson University Extension Program, and the City of Mullins are partners with our Reimagined Gardens program. And we are looking to expand from 1 garden to 5 gardens starting in September of this year. And one of those gardens is going to be an edible forest. Every week, as the food is being harvested from the gardens, from our personal community garden, as well as other people's garden, as well as abundance of food that a farmer may have left over, we do a weekly community garden food share. So if you're looking at the bottom right-hand corner, the lady there, she is shopping for free from the food share. And it's wonderful. Like our food share, when the community comes out, we're out there exchanging recipes, talking about what they're going to do with this amazing fresh food. And people only take what they can use. And that's another thing that we love, because PIC 42 Foundation is not, a big corporation. It's the community owns it. And we want to make sure the community know that they own it. To date, we have served over 5,000 families, and that represents 13,000 community members. Next slide. So when in 2020, COVID was also a disaster, a federally declared disaster. And one of the things that happens in rural communities is a lot of times we don't get access to resources. We don't get access to vaccines. Information may move through our communication, through our community even slower. So what we've done is, in collaboration with 9 other nonprofits, we established the We Care Coalition. And the purpose of the We Care Coalition is to do COVID-19 outreach and to help our community have better health outcomes. I can give you a whole lot of more statistics on the health status of our community, and that's for another day. But to date, we have vaccinated over 700 community members. We ran 18 what we call We Care Coalition clinics, where folks come to receive their vaccinations, first shot, second shot, first booster, second boosters. We work in partnership not only with the 9 nonprofits that are on the coalition, but also with agencies. So we have ran our Department of Health. They are with us. They have run vendor clinics for us on Saturdays at other community events that we had, such as Juneteenth. Matter of fact, if you're looking at that van, that was our Department of Health coming to our Juneteenth celebration. And, so in our rural community, the connectiveness expands beyond just the people and the nonprofits. It's also our agencies. And so I'm very happy about that. Next slide. So the 2021 annual toy drive, I'm gonna try to be really quick. So the toy drive is really what made PIC 42 Foundation. Way back when we were in Charlotte, Christmas just meant so much to my family personally. And my husband was a basketball coach at our church. And after the Christmas was over, he thought, if you're the coach, you're also the ride. So he went and he was picking up the kids, and I'm asking him, how was your Christmas? How was your Christmas? And they told us Christmas was just another day. So we set out to make sure that as long as we can, that Christmas would mean something to children where we live. So when we moved to Marion County in 2016, we also moved the toy drive to Marion County in 2016. And you can see on the right-hand side, those are the volunteers. It took 57 volunteers, and that's just for the one-day event. That's not counting all the volunteers that helped us leading up to that event. And the one thing that we wanted to do is we want to give, because it's neighbors helping neighbors and the community coming out helping the community, we wanted to make sure that the neighbors felt like they were shopping. The same with dignity, right? Not that a child just ends up getting a toy from a charity. We provide wrapping paper, and before COVID, we said gift wrap, cookies, Christmas music, the whole 9 yards. We love it. And there's volunteers that cannot wait for our annual toy drive. Next and final slide, please. So I have shared a lot with you about just some of the programs that we run with PIC 42 Foundation. We also have a celebration of voting that we do, and an annual Juneteenth celebration that we do. But really, the heart and the strength of our nonprofit are the volunteers. We have had to date 508 registered volunteers, and numerous more that I cannot even tell you because they just show up and get to work, right? And some people's like, oh, I don't want to pre-register, but I'm gonna come and help. Or, and so that warms our heart because PIC 42 Foundation is a community organization. And when it comes time to get the word out about events, we have this connectedness and, people feel like they own it, which is just absolutely amazing. So this is my last slide, and you can see our wonderful volunteers over the years at different events. And I'll be happy during the question and answer period to take any questions from you guys.
Excellent. Thank you so much, Miko. We're really excited about today's webinar because Miko is focused on community and connectedness in community. And then we'll move to, a state effort around IT and then to research. But it really relates, your work really relates, I think, Miko, to what I think a lot of us experience and we have at our work at Visible Network Labs, which is that we know people prefer to rely on their informal supports before we go to other systems resources. And so having those informal supports in terms of neighbors and community members helping each other is really an amazing way to organize around helping people build up that connectedness. So thanks so much. What we're going to do is switch right over to our next presenter and then save all of our questions for the end. So we'll go ahead. Thank you again for that presentation. Excellently. Okay. All right. So we're going to switch over to the Colorado Office of eHealth Innovation. And John Kennedy is our presenter today. So John, I'm going to go ahead and read your bio now to get a little bit more about you. As one of OHI's senior project managers, John's work is focused on rural connectivity. He joins OHI with a background as a high-tech project manager with healthcare policy and finances, EPMO, and brings that expertise to bear on the HIE infrastructure and rural connectivity. John is passionate about making healthcare available for all Coloradans and bolstering the data infrastructure, making it easier for members in rural communities to receive Medicaid services. John has spent years in various roles in the military, the private sector, and state government serving the public. And we have a fun fact about John. He has a degree in Korean linguistics and spent a portion of his life interrogating and interpreting for the US Army. So always fun. We love to know as much as we can about the people behind our project. So John, thanks for sharing all that with us. I'm going to turn it over to you now, and I'll move your slides. So just let me know when.
Perfect. Thank you so much, Miko. That was really awesome. I really liked what you had to say and showed. So we'll, as Danielle said, I am with the Office of eHealth Innovation. This is an office that works with the governor's office, Lieutenant Governor's office. Today, we're going to be talking about strengthening social connectedness in rural communities. And as OHI's representative for rural connectivity, I'm going to be able to talk a lot about the efforts the state is working towards. I did kind of give a little background earlier, and Danielle just did read my background. So that is awesome. I really appreciate the way that we've kind of talked through that today. If we go ahead and go to the next slide. So I'm going to kind of start off with some vocabulary. Again, we're going to be talking about rural connectivity and providers, hospitals, etc. So some vocabulary to get you acclimated to critical access hospitals. This is the Center for Medicaid Services designation for hospitals with less than 25 beds, which are greater than 35 miles from the nearest hospital. Rural health clinics, which is the Center for Medicaid Services certification for primary care clinics that operate in rural underserved communities. Rural counties designated as non-metropolitan, and frontier, a subset of rural counties with especially low population density. Note that frontier is not a preferred term. Next slide, please. So why rural health? Why do we have a separation for rural health versus, how else you say it, regular health? To me, what we're looking at as we kind of established those that are less served, that have less access, and it's just a little bit harder to get those connected to our networks here with the with the state. Next slide, please. So there's a higher burden of poverty. 20% of rural children live in poverty compared with 11% of urban children. 12% of rural adults lack basic literacy skills. Lower access to healthcare. 45% of rural Coloradans have public health coverage compared with 35% of urban Coloradans. 54% of rural counties completely lack OBGYN services. And worse health outcomes. 9 of the 10 Colorado counties with the highest opioid death rates are rural. And rural teens are twice as likely to complete suicide as their urban peers. Next slide, please. So we're working to reduce the rural connectivity gap by facilitating HIE connectivity, which is to subsidize fees and provide technical assistance to ensure easy connections. Providing real-time analytics, which is to establish and expand data connections to make holistic patient and business data available in one place. And of course, applying technology to practice. Operationalize those tools to optimize workflows, reduce provider burden, and improve reporting capabilities. Next slide, please. So progress to date, if you'll go ahead and go to the next slide. So prior to where we are now, most of our work and efforts were done under HITECH. Some of you may be familiar with that. That was a funding stream that came from the Centers for Medicaid and Medicare Services directly to Colorado that helped us to reach out and connect to various providers and kind of further technology and innovation in Medicare and Medicaid, specifically Medicaid. So up to date, we've done, the analytics platform has developed, 75% of safety net facilities have access. Environmental scan has been completed, 61% of safety net facilities participated, and HIE access is improved. 20 new safety net facilities have onboarded. Next slide, please. So after HITECH ended, these funding streams, which was just so everyone knows, HITECH ended just 2 years ago. And all of the work that was being under HITECH was then moved into its own separate area. So rural analytics was taken out of HITECH, and now it's its own working, operating program that we're working towards. And as we work towards that, as we get our own funding for that, the state has $11 million to spend for rural connectivity, to get rural analytics, to get data and information out to our rural providers and from our rural providers, which will better help us with all of those statistics that we were talking about before. 72 of 84 total rural safety net facilities are connected to our health information exchange. The HIE connectivity strategy to connect remaining critical access hospitals and rural healthcare clinics has been finalized. Additional rural connectivity funding has been approved for state fiscal year 23, and an implementation plan for a minimum viable product solution for analytics with a fall 2022 release. So coming up right out the gate. An outreach program to reach the remaining rural providers is in the works and will be completed by the end of 2022. That's going to entail us going directly out to these rural communities and counties and reaching out to them and saying, what's the best way to get you connected to our HIE system? The more connectivity we have, the more data we have, and it's the best way for us to help serve our members. When a member's Medicare and Medicaid services are connected, it helps us to better understand how they're being served, what they're being prescribed, what treatments they're receiving, and things like that, so that their primary care physician knows what's happening and they can better serve them. Our focus for continued effort is independent and rural health practices where most rural patients and visitors receive care. Improved condition results in this outreach and this connectivity is a better experience for patients, lower burden for providers, and a cost savings for all. So I kind of talked fast there and I apologize. I know I wanted to get it within my 10 minutes, but I know there will be a question and answer period. So please, of course, if you do have any questions, save those for that and I'll be more than happy to answer.
Awesome. Thank you, John, so much. Yes, if anyone has questions, put them in the chat. We just want to get through all of our presentations, so we have time for those at the end. But I know being in Colorado, I've been so impressed with what our Office of eHealth Innovation has been doing, and such a strong focus on rural communities. And I'd love to hear more from the people in the audience and how that relates to what you're doing in your states, what questions or advice you have also for the state of Colorado. And I wanted to mention that some of John's OHIVE team are also here on the call. So lots of folks here to answer some questions. All right, so I'm going to stop sharing so Dr. James can share her screen. And Kathy, while you're pulling that up, I'm going to go ahead and read your bio. So next we have Dr. Kathy James. Dr. James is an epidemiologist and engineer who specializes in environmental and climate risk factors and health in vulnerable populations. She has experience in leading and conducting community-based research projects, including NIEHS-funded studies investigating exposure to metals and cardiometabolic and kidney diseases. Dr. James is currently leading 3 community-based studies investigating the impacts of long-term drought on a rural community, including access to water resources, the impacts on agricultural workers and mental health, and water quality and exposure to pregnant women and children. Dr. James is also the PI for the Attitudes and Behavior Study, a repeated population-based survey of tobacco and marijuana use and other public health issues. And my fun fact about Dr. James is that we get to work with her on a project. Visible Network Labs was lucky enough to get to participate in an ongoing project. And I don't know if you're going to even talk about that today, Kathy, but we're just really excited to be a part of the amazing stuff that Dr. James is leading. So I'm going to hand it over now and let you take over.
Great, thank you. I'm assuming you can see my presentation. Okay, great. And actually, it is the study that we're collaborating on that I'm going to highlight. So thank you, everyone. I'm going to be presenting about our work specific to a rural community that I've been working in for the past 15 years, the San Luis Valley, highlighting our one of our multiple studies that are down there specific to working with farm workers during the time of climate stressors, especially drought, and the social network analysis that we are leading. So as an introduction to myself, I'm an associate professor at CU, and we kind of covered this, but one of the key things that I wanted to highlight is that most of, if not all of our work is community-based participatory research, and involves not just the partnering with our community members from the start and the initiation of the concepts of the study, but all the way through and then all the way into the report and manuscript draft writing. And so we have several networks within the community, the organizations, health providers, schools, teachers, community advocacy groups, and we feel very privileged to be able to work with them. So the San Luis Valley is located in south central Colorado. It is the largest mountain desert in North America. It's also a community that has one of the most richest cultures and histories in the West. Their economy is mostly agrarian and tourism. Their agrarian economy is mostly potatoes. They're the 5th largest producer of potatoes in the United States. They also produce barley and alfalfa. Hemp is also a new product, and then also cattle ranching. Within the tourism, the San Luis Valley is also the location for the Great Sand Dunes National Park, which is also one of the more popular national parks in the US. So unfortunately, the community, which is bounded by 2 very large mountain ranges on the northeast and the northwest, and then to the south, it flows into New Mexico through the Rio Grande Rift and aquifer and river systems. But the community itself has been experiencing a prolonged drought since 2002. And this is as a result of changes in temperature patterns, including increases in average temperatures from about 61 to 64 degrees. And these changes in temperature have led to a decline in the snowpack, which is the greatest source of water for the community. And then not only that, but the snowpack is also melting faster and melting earlier. And all of this has dramatic impacts on the farming system, not just for access to the quantity of water, but then also the timing of when they get the water. Additionally, not only is their surface water and river systems declining, but so is their aquifer system. So this overall drought process has had a dramatic impact on the farming community. Over the past 10 years, there have been many farmers who have been incentivized to fallow their land, which means it's a non-producing land. This has led to decline in food production, a decline in the economy, a loss of this lifestyle and heritage that's very important and has been in the San Luis Valley for the past 180 years. It also has led to an increase in anxiety and depression, and then also addiction and suicide in our farming community. So through my community networks with my other studies, I work quite a bit with occupational cohorts, including the agricultural community. And it was after meeting with some of the agribusiness leaders, farm owner and operators, and the farmers union that I became quite passionate about the mental and behavioral health for the farmers given this drought. And the reality is this drought isn't going away. This is projected to be a long-term community adaptation and mitigation process. And so we have connected with several national organizations, including AgriSafe, that leads several efforts across the nation specific to total farmer health. And so this is the model that we've incorporated for our study that looks at the burden, the need, and the impact specific to farmers, where the burden is on financial stress, chronic pain and illness and drought, and including right now, especially right now during this economic period of time of financial stress, where we're seeing fertilizer and fuel being probably the greatest burden financially, outside of the fact that they have less access to water. And the types of questions farmers will wake up is, do I need to slaughter my 8 cattle because I can't feed them? And so to wake up every day and have to have those major types of decisions can induce quite a bit of adverse mental health. So we're partnering with Vision Network Lab, and we're leading a 2-part community-based survey for agricultural workers because probably the most important thing we identified is that the extent of behavioral health and what are the resources and what are the connections, the extent of that has not been very well characterized. And so that's the purpose of this pilot study. And so we are using the Partner Me platform developed by Vision Network Labs to interview 250 agricultural workers just to understand what is the extent of their well-being and what resources do they use or do they have access to within their communities. We are, and I should stress, we're including both farm owner operators and then also field laborers, migrant workers, and then also seasonal laborers. So the Partner Me worker survey specifically for the ag workers it involves an online platform that will assess about what are their typical stressors, and they will identify what are their stressors, what are the resources that they use, are they community-based resources, are they peers, are they worker-based resources, and then the platform will then develop these connections within them and will provide a report for each individual. With this report, then VNL is also going to be completing an extensive analysis, social connections analysis, coupled with our additional survey that does a complete well-being assessment of the farmers. So all the participants will be compensated for their time. They will be provided with some immediate results, and then they will also be provided with a full summary report of representing the entire community. We do also have built-in parameters so that if any participant identifies a level of stressor or any level of depression or anxiety or suicide ideation, we do have pop-up resources that they will be immediately directed to. As the second part of this is we're then going to be interviewing and meeting with the community resources that are there specifically for behavioral health. This can include agricultural and agribusiness centers, medical providers, religious groups, peer groups, the agricultural extension offices, and then also resource centers. The point of contact at each of these organizations will be compensated for their time, but by bringing together the organizational connections and the resource connections along with the individual farmer connections, we will be able to identify and thus be able to develop an engagement plan. How do we best work with the community to engage with farmers as a way of, one, reducing the stigma of mental and behavioral health, and then also ensuring that they're getting access to the resources that they need. Oops, hit the button twice. All right, so absolutely along the same lines that Mika was presenting is that the key thing is that rural communities are extremely resilient, and they have an extensive amount of local and community groups that are working every day to support one another within their communities. We have agricultural efforts through the Farmers Union and the Potato Administration Committee. We have water conservation groups, including the Rio Grande Water Conservation District, the Water Conservation Education Initiative, Headwaters Restoration Projects, the Headwaters Trust, the San Luis Valley Ecosystem, and the Headwaters Alliance. And the key word being their headwaters is because the San Luis Valley and their snow and their water systems is the headwaters for the Rio Grande River system, which is the fourth largest in the United States. Additionally, there are community resources such as mobile health clinics and housing and resource centers. We're additionally partnering on a national level so that we can immediately provide interventions and resources for the farmers as soon as our pilot study is over, including AgriSafe, AgriAbility, and AgWell, all of which are focusing on total farmer health and mental health. And thank you so much for your time. And I'm looking forward to answering questions and shared questions with the other panelists. So I will stop sharing.
Great. Thank you so much to all three of you. The breadth of what you covered in this very short time frame is amazing. Let's go ahead and get some questions out. We have a few more minutes here, and we want to spend them hearing from you. So we have a couple already, and if you have any others, go ahead and send them. You can send them to Alex or myself or to the whole group. But we're going to go in order. So let's go back to Miko. So we have a question. Since you've had experience working in both urban and rural communities, how would you suggest folks that are living in urban communities support these organizations and efforts happening in rural communities? What's your advice for that kind of outreach and connection between two different areas?
Absolutely. You know, without a doubt, there's more financial resources that are available in the urban communities. So if the urban communities can support the rural communities, at the end of the day, we'll all be a better country, a better planet. So that's without a doubt. The other thing I would suggest is that if you're an urban community looking to work or partner, I'm gonna say partner because it really is a partnership with a rural community, is get to know the community, because that tells you where the heart is, and get to know the folks that are working in that rural organization. Because just by having, we partner with so many local nonprofits in our community, and we do that so that we don't step on each other, right? So I have a partner who runs the homeless shelter. And so I fully understand what she does and her organization does. So if somebody says they have a need, I kind of know where to direct them to. So I think it's really just communicating and understanding the people who do the work and the community that they serve.
Awesome. I don't want to skip any expertise that Kathy or John might have either. If either of you want to jump in to answer any of those questions, just unmute and then I'll know. So, okay. All right, I'm gonna keep going so we get a little bit from everyone. Thank you. Miko. Okay, so John, we have a question about what you might have seen as a surprise or something that you've learned about outcomes related to increasing technology and connection in rural communities. You've been doing this work for some time. So, what's been one of the greatest successes or surprises that have come as a result?
Definitely. I would say I'll start with surprise, and then we'll get to a success. One of the surprises that I guess something that you kind of know but you don't really experience is that the rural communities in Colorado are they're not into big government. They're not into that kind of connections, right? So that was surprising to me because to me this is something that helps everybody, and I feel like everybody gains from this, right? And so just to kind of get out there and meet that stigma, that's definitely something that was a surprise to me. As far as successes is how we've been able to kind of overcome that, right? We have our HIEs that are, we have two major HIEs, which is Health Information Exchange. We have one that serves most of Colorado, but we have one that is on the Western Slope. And so they definitely are able to connect a little bit easier. And also we have our CCMCN, which helps as our backbone of our HIEs, which is also rural, and they're able to connect with these rural providers. So I definitely think that's been a success, is getting our name out there as OHI, right? The Office of E-Health Adaptation, and kind of taking that stigma away, because I think people get when they're talking with someone from my office, and I have a couple other members on the phone who are wonderful. I think they get that we're just here to help. That we're all people that are here because we want to help. That's what drives us.
Excellent. Thanks so much. Let's see, I'm gonna ask the question that just popped up in the chat from Amelia. So Dr. James, with the aging of farmers in rural communities, what other aging issues are you seeing or experiencing?
That's a fantastic question. So the community also endures some of the same health burdens in their aging population as other rural communities. But in the San Luis Valley, we're also seeing high rates of chronic kidney disease that's not specifically attributed to diabetes or hypertension. It's actually being a lot attributed to dehydration. So the San Luis Valley is one of the driest areas. It's a mountain desert, and that long-term exposure to very arid conditions, outdoor labor, has increased the rates for chronic kidney disease. We're also seeing the fact that the topsoil, the top layer of aerosolized topsoil, is becoming bigger, which means that there's actually more dust in the air. And so we're seeing multiple dust alert days, and associated with those alert days, we're seeing more ER and urgent care visits as a result of COPD, congestive heart failure, and asthma. And this is especially true for wildfires. The San Luis Valley has been the location of 2 of the 5 largest wildfires in Colorado history. And so the respiratory burden, along with the cardiovascular burden, is definitely exacerbated because of the drought.
Awesome. Okay, so we're just in our, thank you. We're just in our last minute here, and I want to put out one last question for all of you. Miko, you're living in the community. The others are coming maybe into the community. We know that there's a need for trust building when we want to work with community members, study with community members, or bring resources from the state, and you've mentioned that a little bit, but in just a few words, how do you build that trust? How do you actually come into a community and we want to help you, is what I heard. How do we help? How do we make them believe that?
Absolutely. And And I think it was Catherine who said it as well, about it's about trust. That's what makes our organization and organizations that are working in the community different. But the way you get that trust is through transparency, right? So you have to show up. You have to, if you say you're going to do it, you need to do it, and then you need to report on it, right? So with our nonprofit and me as executive director, I treat it the same way I did when I was in corporate America. So in corporate America, when you had a project and you finished the project, you did a status report. So guess what? We do status reports. They just look like Facebook posts. We do videos, right? So it's like, so we're trusted because I'm not just saying that we're doing these things, is that I'm showing you the results of what was done because you got involved. And also somebody asked a question in the chat, like, well, volunteers, how do you do it? I'm not afraid to beg, right? And so, when we have a free store, our free stores take about 30 to 40 volunteers at a minimum. So it's like, we got to do this for the community, and I can't do it if you're not here, help, right? And so that's why I was saying, I forget the other question, but, and somebody had asked, well, if the urban wants to connect with the rural, it's important that you know who you're working with, because I don't lend my favor in the community to nobody, right? So if I'm going to send out a text and say, hey guys, this organization is coming and they want to help us, then I have already done my research search, and I know that they're going to do it. Right. And they're going to be held accountable for it. And you know what? The same way you share your successes, you also have to share your oops, that didn't work out. You got to share that information. So as an example, at our community garden, somebody stole the tires off our food truck van. We had a little cart, right? So I know, right? I see Catherine, but still, we shared that because it wasn't just Pick 42 Foundation that they stole from. It was the whole community that they stole from, and people were outraged. Right. And so I hope I answered your question.
Yeah, wonderfully. And then some. Thank you so much. I know we're over just a few minutes, so if anyone needs to drop off, we'll finish the recording and you can watch the end. But I want to just see if Kathy or John also have advice.
I just kind of wanted to comment, piggyback there on what Nico just said. That so much of that it applies, right? We're accountable. We're showing what we're doing. We're showing the dollars. We're showing how we're spending them. We answer to the public, and we answer to CMS, which is the Centers for Medicaid Services, which is the federal government, right? So there's just so much that it's all transparency. And I think that's so important, and anything that we're doing, especially in these kind of conversations.
Excellent. Thank you. And Dr. James, any final words on coming into community, building trust?
I mean, 100% agree. You have to have the trust and the consistency in that trust. And so making sure you're replicating the effort and the results reporting and the communication across each of your studies. Well, in my case, across my studies or across all of your efforts. The other key thing that I always recommend, and I always, when I'm working with new people and they're coming researchers that are engaging and working on our studies in this community and are new, first thing I say is you go in and you listen, because they're the experts. They know what they know what they know, and that's the most important thing. And so the first step is to listen. So.
Oh, such great work. And I want to just say thank you again for everyone who's here and the work that you're doing. One thing I heard all of you say is give back to the community. Like if you're working with them, if you're asking them to give you something, give back. So especially around data, we really believe in the same thing at VNL. We want to make sure that if we're asking people to answer questions, that we're giving back to them. So I think that's especially true in these communities. So thank you everyone for today. All of our speakers, I'm sure, are open to more connection, and we look forward to seeing all of you again at a future webinar. So have a great rest of your week. Stay connected. Thank you all so much for the work that you're doing.
Thank you, everyone.